Welcome to Inside Social Care, the podcast that takes you behind the scenes of the care industry. Join us as we explore the challenges, celebrate the triumphs, and shine a spotlight on the incredible people who make up the social care workforce. From personal stories to policy deep dives, we're here to give you an unfiltered look at the heart of our communities. This is Inside Social Care, and this is where we start the conversation. My guest today is the Managing Director of Island Healthcare and one of the biggest cheeses on the Isle of Wight within social care. Welcome to the pod, Ian Bennett.
Morning, Charles. Thank you. I'm not sure big cheese is an accurate description, but I'll take it.
How would you describe yourself then?
I mean, I'm a representative of the rest of the sector on the island, and I think that's as much as I'll give myself credit for. But I am, quite passionate about trying to fix this sector locally and nationally. So yeah.
Great. Well, looking forward to hearing all about that. So Ian, why don't you kick us off? Tell us a little bit about your professional journey, your story, because you did some interesting things early in your career that I think probably inform what you do now. Over to you.
Yeah. I mean, it's an interesting journey. It's the family business that I now run, but I started working in it when I was 14 and had sort of been in and around it my whole life. Of my earliest memories of riding up and down stair lifts, stealing cakes from kitchens, getting myself into trouble in and around the care homes that my mum at the time was managing. So it does feel that it's in the blood quite a bit. I did take a break and went to university and did all that normal stuff and worked in Westminster for a couple of MPs and then for Parliamentary Information Service after that, which was fun. And then once my wife got pregnant, we decided that actually a life on the Isle of Wight was better than the big city. So we moved back and I rejoined the business in a more senior role. And then, a few years ago, took over as managing director just after COVID, which was a fun time for everyone involved. And yeah, I've been sort of doing it ever since, really, trying to get involved in stuff. Started the Isle of Wight Care Partnership by merging the various associations on the island and got involved with Care Association Alliance and a couple of other organisations from there. So yeah, it's been a fun journey.
Great. Awesome. Let's go right to the beginning of it, because I think I'm particularly interested in your time in Westminster. Tell us a little bit about...
I mean, it was great. I studied politics at university. It's been current affairs, and that is actually one of my keen interests, even as a hobby, which probably sets me apart as being quite a boring person. But I think Westminster does give you that insight into, I think it's how the sausage is made is the analogy that's often used. Yeah, I think there are a few key things that I learned from there, which has informed some of the stuff that I've been doing later. So I guess the first one is that, all of these policymakers, whether they're national or local, they are trying to do the right thing. They all have people's best interests in mind. They just have different ways of going about it, and they have different ideas and philosophies that inform that approach. And I think it gives you quite a good insight and attitude to go into these conversations in a way that says, I know you're trying to help, but perhaps you've got your ideas wrong, and how can we help change that? I don't know. I wouldn't say I've been particularly effective at that, but I keep trying. And I guess the second sort of main thing that I learned from there, and just my time following politics and current affairs, really, is the importance of democracy in the way decisions are made. So you always have these competing interests, and politicians' main aim is to get re-elected. That's what they're always trying to do. And I think the way that impacts social care policy is, until people care about social care, the politicians are not going to care. And I think that's the bit that we're really missing at the moment in social care, is people, they don't understand it until they come into contact with it. And even when they do come into contact with it, they really struggle to understand it then. They don't understand why it's not part of the NHS. They don't understand how funding works. They don't understand how assessment works. And it's all just very, very complicated. And until they have that understanding, until social care is put on the same level as the NHS, we're never going to get the same kind of, X billions at every budget and politicians applauding for us on doorsteps. And, that one of the things that happened during COVID that most stuck with me and actually with a lot of my colleagues was the 3 days we spent clapping on our doorsteps for the NHS with no one even considering social care, who were going through exactly the same, if not sort of worse challenges at the time. And I know a lot of my colleagues and a lot of the managers there were really upset by that. And it just speaks to because the people don't give it that value, because they don't understand it, we're always going to be seen as second.
So a few things within that, I guess, roll back to your comment about politicians always looking to get re-elected, which is an astute observation. And the cynic in me would say that that will prevent you as a politician from making some of the right decisions. Yes, people go into politics and want to do it in order to help people. But the problem is if everything's framed within how well it tests with focus groups and whether you're able to, increase your voter base based on the policy, does it stop you creating policies that are like good for the long term? And I guess like social care, I think has been like a real victim of that. And as you say, NHS is perennially the sort of vote winner at an election, which party thinks that they can go in and do the best for the NHS. Social care never really seems to have been anything other than a vote loser when people try and tackle reform in the sector. How do we change that narrative?
I mean, you're absolutely right. And I think one of the big problems in politics is that we have short-term thinking that lasts for 5 years between elections, and no one is prepared to tackle these problems. And social care is in its very nature a long-term issue, because you look at demographics and you know that the country is aging, we're getting older, there isn't enough young people to pay for all of the older people who need our support. And like you say, that requires long-term thinking. The big issue, I mean, we saw in Theresa May when she released her manifesto and she looked at her poll lead, 20 odd points ahead, and thought, actually, I can take the risk of being quite honest with people around social care. And that was instantly branded as a dementia tax. And then she proceeded to not lose the election, but draw the election. And I think that taught politicians the wrong lesson. I mean, it taught them, let's actually not be honest with people. Let's not say that the country is in a real difficult situation with social care, because the honest answer is people are going to have to pay more for it in one way or another. Because there isn't enough money and because it is so expensive. Every time the government come in and they release a new commission, or we've got, Royal Commission now led by Baroness Casey around social care. And the idea is to bring everyone together to come to a coherent solution. My worry is that is now not going to report until just before the next election. And then we're stuck in the same situation. So you have this government either not adopting the policies because of the impact it will have and their fear of winning the election, or they do adopt the policies and another party will attack it as, well, you're going to have to raise taxes for this, or whatever that might be. And we're just stuck in this doom loop. I think it requires real leadership. I think that's where how you move those conversations on, is you have to have real leadership in this situation. There's no way of doing it without somebody being prepared to take the risk and bringing the country along with them.
And if you were in the hot seat and actually defining some of the social care policy, and particularly around the funding thing, because I think that's obviously that's like the key issue, and the realization that people are going to need to pay more for their care. How would you headline want to tackle that? Is it like increase general taxation, hypothecated taxes, or is it more like, I don't know, what would your suggestion be? And don't shy away from that.
Yeah, I think it's really hard, and I hope that I'm never in that hot seat having to take that decision. But I think you do. I think you have to have an element of contribution. So I think people ought to be paying into insurance policies, which cover the eventuality of their, needing complex dementia care, or because we still, as we know, we have people who have complex needs, and we manage a lot of them at Island Healthcare. I think when you work in the sector, you can become blinded to the fact that actually that is still only a small proportion of the population. So if, a bit like car insurance, if everyone paid into an insurance policy, whether it's a nationally provided one or a private sector one, that then covered their care costs or a proportion of their care costs, that would go some way to helping. I don't think we can afford to do it on a national free at the point of use. Everyone, the NHS is just going to pay. I just don't think it's affordable. We've seen our costs going up and up and up. A lot of that, there's a lot of government decisions around that as well. So every year we go into a budget and the government go, okay, I'm going to be putting up the minimum wage, because it's great headlines for them. It doesn't cost them a penny. In fact, it brings more money in and taxation. But what they don't realize is that pushes up the cost of social care. They then don't find local authorities enough to cover all of that. And we end up in this spiral of not having enough money. And, I try and avoid conversations around money and social care, with local government, because I know that there isn't enough money in local government to pay for what it costs, and the conversations need to go higher than that. But then the government will say they don't have enough money either. We went through that fair cost of care exercise a few years ago, and I think it was under Boris Johnson, and it just got abandoned when the results came out, because they realised actually quite how much it is costing. It's a phenomenal amount of money, and the difference between what it's costing and what the state pays is being picked up by people. And, to a certain extent, we have a generation of people. It's the generation above mine, and guessing yours as well, Charles, who they did awfully well out of asset price growth and house price growth, and maybe they should be contributing some more of that cost to their care. But this idea that the minute you suggest that it's a dementia tax and it's unfair is part of the problem. And actually, to a certain extent, I feel like it probably is unfair, and it's a complete lottery. So, why, just because your dad gets dementia, do you have to forgo the inheritance and the family home and all of that stuff? Whereas somebody down the road who is lucky enough not to have had dementia can pass that whole legacy on. And I think that's why I think you need to have some kind of contributory insurance system to spread that burden across the society without it having to fall on the shoulders of government.
And I guess
but it is, there are probably loads of challenges to that and loads of issues that if you would speak to a policymaker, they'd raise.
And I guess some of it comes down to fundamental questions about what the state is for and what your own, personal responsibilities are, right? Like, there's a relatively strong argument to say you work your life to save for your retirement, and if you have a large amount of assets within your last few years and require care, that your assets should be going towards care. There's a strong argument for that, but I totally get it. Like, if you're unlucky enough to suffer from dementia versus cancer, then the difference in what the state will pay for is quite remarkable. So very interesting.
Another big problem is that the state don't see dementia as a healthcare issue; they see it as a social care issue, and I think that leads to a lot of this problem. And I spent a year working in commissioning on a secondment, which was really interesting. And part of that year was about trying to integrate health and social care, because that was the thing that was in vogue 5 years ago. And actually, particularly on the Isle of Wight, that seems to be, in my mind, the only way you can fix the incentives in the system. So, around hospital discharge, at the moment, you have somebody sat in a hospital bed. It's costing the hospital between £2,000 and £5,000 a week to keep them there. But if they go into a care home, that budget then becomes the local authority's budget.
Yeah.
So why would the local authority pick up a budget of £2,000 a week to save the hospital an extra £3,000? Do you see what I mean? So until you align those incentives, it's never going to work properly.
I had a fascinating conversation with a lady that ran discharge team at a hospital in Wolverhampton. It's quite amazing. I remember from my time when I was a doctor, I remember my time trying to navigate this sort of whole discharge maze. I said, how much of your job is patient care versus politics? And she was like, well, it's probably about 95% politics is, trying to persuade. And I totally get it. Like, you would understand from your organization as well. If you have two separate pots of money, two different org charts and two different incentive structures, where is the thing that's going to make them work well together? I think that's one of the fundamental challenges, is that you can't have that joined up health and social care situation if the money's come from two different places. So you talk about the Isle of Wight.
Yeah.
The Isle of Wight, quite a unique place, the Isle of Wight.
It is. Yeah, it's beautiful.
Yeah. It's lovely. Yeah. I was cycling around there this summer. It was very pretty. But I think you have probably some relatively unique challenges from a sort of social care perspective, I think. Can you talk to any of those?
Yeah. I think the big one is demographics. And I think we're around 10 years ahead of the rest of the country in terms of how our population is aging. A lot of that's down to people who spend childhoods and middle age holidaying on the Isle of Wight go, actually, I'd really like to retire there. So they move away from their social network and their family network, and they come to buy a nice bungalow in a pretty village miles away from urban centres in their 60s. And then by the time they're in their 70s, they suddenly need social care. And it's the local authority that has to pick up that. So that's a big challenge. And then sort of almost related to that is workforce. I've been listening and reading quite a bit recently about demographics. So if I get sort of stuck on that subject, you might have to move me on. But
no, I think it's my favourite subject as well, actually, demographics.
Yeah, I think it's super interesting and really quite frightening, just the way this is changing and how and how quickly. But yeah, so it's related to that aging population, is the fact that, we focus on the old people that need care, and we forget that the other side of that coin is there aren't enough young people coming into the workforce. So, I mean, our average age of our workforce is going up and up and up. So we're sort of into our late 30s, early to mid 50s now as our average age.
Right.
A lot of that before COVID, it was a real struggle. Then COVID happened, the carers were added to the shortest occupation list, and we started to recruit from overseas, and that brought that average age down, and it really, really helped do that. But yeah, I mean, our biggest struggle is recruiting people, and not just recruiting carers, our sort of frontline staff, recruiting managers, recruiting seniors, everyone up. It gets harder and harder. Finding a good registered manager at the moment is a real struggle. People don't want to do the job. We have the natural progression would be your deputy manager would become your registered manager. They'd learn from the job and they'd be good at it and they'd hit the ground running. But now I speak to deputy managers and they go, I don't want that job. I've seen how hard it is. I've seen the hours that they're doing, the legal burden that they're under, because they're individually named and individually responsible for the operation of the home. And that's one of the other bugbears of mine. And actually one of the things that puts me in a bit of not conflict, but disagreement with some of my colleagues in the sector. I actually don't think registered managers should be legally responsible for their home. I think it should be the provider should be legally responsible for what happens in their home. As with other businesses, Charles, if you break the law in your business, that's on you. Whereas if one of my care homes breaks the law or does something wrong, the first person it's on is the registered manager. And that just really puts people off doing what is already a really difficult job. I mean, it's incredibly rewarding. And, I'm happy to talk about that as well, because I think sometimes we can get stuck in this rut of talking about the sector really negatively. We were talking a little bit before. I've had a bit of a difficult week this week, but the 2 weeks before that have been amazing. And I walk. I'm based in one of my care homes, and every single morning I walk from the left hand side to the right hand side. I greet all the clients in the morning. Came down this morning, I had big smiles on the face of a few ladies sat around, and they were having a laugh and a conversation with each other. And it's so lovely that we can provide those services for people. And I'm a passionate advocate of residential care as well. And we provide a bit of home care, but I think good residential care is often neglected. We get stuck in this. Everyone wants to be at home narrative, and we can do a lot in residential care that you can't do at home for people.
And so you're also increasingly involved now. So you mentioned obviously your role within care associations on the Isle of Wight, but I think you've not set up or started to get involved in like a think tank or something.
Yeah, I didn't set it up. I can't take credit for that. But there's a group called Reinventing Social Care,
right?
Where we're a group of providers who were sort of invited by a guy called David, who runs a learning disability service in Surrey. A lot of us met through the Care Association Alliance, and we took upon ourselves the difficult challenge of fixing social care in a really positive way. And so I joined during the sort of writing of the second report that the organisation did, when I'd encourage everyone to go and download it and take a look at it. And we're sort of currently working on a refresh of that and trying. We had a fair bit of success getting in front of politicians. We had some really good connections at the Department of Health and have good meetings with ADAS and good conversations, and just really trying to do it in a positive way. And I think that's really important, because like I said, often you can get stuck in this rut of just, here are all of the problems in a long list, now go away and fix them. But actually, if we can suggest some ideas about how this might work. So for instance, next Thursday, we have a meeting, and one of the members of the group is Australian. Her sister lives out there, and they've got a really interesting system of the way care is commissioned and paid for, and her sister works within it, and she's going to come and talk to the group and outline some of that. So we're just seeking ideas really, and trying to put stuff together in a coherent way, and doing our best to sell that, to not sell it obviously, to market that to people who have influence. But again, for me, and it goes back to the very first point I made, that's all well and good until a politician says, well, yeah, but how many votes am I going to win from spending billions on social care, or the government bandwidth of trying to do some of this really complicated reform?
So on that point, because I think it's probably the key thing to try and drive social care reform up the political agenda, is changing the public narrative around it, or at least increasing the importance. what is it that we need to do there? Because I guess like for most of Joe Public, people's interactions with social care happen in a very limited portion of their life. Like, you know, with the NHS, you're born within it. You know, you will engage with your GP on a relatively frequent basis. You might have a baby, and then obviously you'll probably be a very high user of it in your like last few years of your life. But social care really does tend to only come at a very small part of your life journey.
Yeah.
What ideas have you got of how we can start to, you know, increase public awareness of the issues within the sector?
So I think it starts in schools, and often I tell an anecdote quite often if I'm speaking to people. My wife's a primary school teacher, and she was working in a school on supply, and they were reading the book "All the Places You'll Go," I think it's called.
Yeah.
And yeah, and it's and they were just reading this book, and at the end, the headmistress walked into the classroom and sort of said to the class, "Excellent, that's taught us a really good story. If you work hard at school, you won't end up working in care." You know, that's like Amy came home and told me that, and it sort of, it really hit me, and it makes me very emotional to think that there are kids out there who are given that message that working in care is the worst thing you can do in a society.
Is that true, that story?
Yeah, no, 100% true. Yeah, and
That's awful.
It's terrible, isn't it? And she won't be the only one, and that won't be the only attitude that there is. You know, I went to a school. It was funny. We were invited to this school careers fair, and we thought, excellent, we're going to go in there and we're going to be talking to a load of sixth formers about their, you know, what they want to do when they leave. We might persuade some, we might get some to come and do an apprenticeship with us. And the school came through and they were like, okay, we're going to bring every single year group from year 7 upwards into to see you. So we had all of these young kids, and it was really amazing when you started to talk to them, because they had no idea, you know, they would go, okay, you got to go and speak to every group, every table that was there. So they didn't come and choose to speak to us because it was an appealing career, but they were forced to do it. And when they did, and we could start opening their eyes and say things like, so what is it that interests you in a future career? Well, you know, I like working with people. I like, okay, well, you know, we do working with people. That's what we do. You know, we care. And they go, oh yeah, well, my mum works in care, and actually she really enjoys it. And you start having those conversations and start opening their minds to, actually, there is a career here, and you can explain to people, you know, there is a pathway from being a carer to being a registered manager to operations or business ownership, or, you know, all of these options that you can do within care that they'd never had their eyes opened to. I like, when I was way back, I think it was David Cameron did the national, what was it? It was almost like a national service thing, wasn't it? Where people were doing voluntary work, and you sort of think, you know, that might be great. Come and work in a care home. I started in a care home when I was 14. That was my first job, just in a kitchen, doing the washing up and making breakfast. But I saw the good work that was being done, and saw that it was really, really powerful and very rewarding to have those relationships. And, you know, I built up relationships with old people that I never would have had otherwise. And you sort of, one of my colleagues, and he's on the Reinventing Social Care group and runs an organization in Dorset. He was saying, society, we're really ageist, and we don't look after our old people. We don't talk to, and I think a lot of that's because we don't talk to them. We don't hear their stories, and we don't get involved in them. We just go, no, that's a difficult conversation. I won't go and visit Nan in the care home. She's fine. She's safe. She's looked after. And that's part. Yeah, I think getting to schools, do some of that good communication work. And as providers, we have a responsibility to do that. You know, I was the only provider at this school workforce day, which I just feel like, yeah, it was a whole day out for me and 2 of our HR team. It was a lot to do, but could be potentially really valuable if the whole sector gets in there. And we miss that sometimes.
Right. And your interest in demographics, I'm very interested in it as well. And I guess you can look at some of the population pyramids and how it's progressing, and the narrative around dependency ratios and where they're going, and get relatively morose about it. And I think pessimistic about what's coming. I guess the flip side to that, if you'll humor me, is that as more and more people become closer and closer, or better, more and more recipient of social care, it will inevitably improve some of the visibility in the sector. It will improve some of the requirements for governments to listen to what's going on. And actually, if we think about the the nature of the workforce and how that's changing with the adoption of things like AI and more people, jobs changing, maybe there's a world where we could be relatively bullish about, the future of social care and it being, a driver of change and growth in society. So yeah, I don't know.
Yeah.
I have degrees of optimism.
I think, and that's a good place to be. I think I had to be optimistic about it. I think the optimistic case for me is that care is going to be one of the only careers that can't be replaced by AI and robotics over the next 20, 30 years. We look at productivity gains and you go, if you're running a factory making widgets, you can replace 90% of your workforce with a robot and an AI computer that manages it all. In care, we can become more efficient in some of the paperwork we do, and we can become better at preventative stuff. And there's some really good work going on around using technology. I visited a friend's care homes the other day, and he had all these sensors in rooms, and they could predict someone's health deterioration much faster than your usual method, just by doing things like, okay, they're moving around less, or they're going to the toilet a bit more, or a bit less, or they've got more disturbed sleep or less disturbed sleep, and they're managing all of this stuff. And then it all gets pumped into, you could see a world where all of that data gets pumped into Mary in room 25 is looking like she's deteriorating. We've got all of this information from your care plan around what food she's eating, how much water she's drinking, all of that stuff. And here is a refined care plan which will improve her health or help her to prevent the UTI or prevent the fall that she might have that might make her condition worse. So there's definitely that. And I think we look at LLMs and there's probably efficiency gains there around the paperwork, which is such a burden at the moment. And again, that's one of the things we always talk about, the burden of paperwork in health and social care. You know, from when you were a doctor, I mean, how much time did you spend just filling out forms?
Totally.
Yeah. And that's got better, I think, with care planning. With e-care plans. It hasn't been quite the panacea that we're all promised by these organizations, because actually what it does is there's nowhere to hide now in the way that their patch used to be, because instead of us going, okay, we're going to sit down or our carer is going to write their notes at 2 p.m, we say, you need to be taking your notes all the time. Now there's more to do because you're actually being more proactive and more responsive to stuff. It's also highlighting there's issues here. This paperwork hasn't been done correctly. In the past, that could be hidden in a way, but not now. So I don't think that's given us the efficiency that it could do, but there is potential there with AI and with LLMs. But I think as we look, what I can't see is the need to reduce my frontline care workforce, because I mean, I don't know about you. I don't want a robot wheeling itself into a bedroom, flipping Nan over every 2 hours and then wheeling itself out again, because the whole point of care is the social interaction you get with it. Yeah, we're keeping people safe and well, but if you lose the social interaction, then that's, I'd say, 80% of the job gone. There might be an element of making it safer if you've got people if you have a machine that can come and do some of that turning and support a carer to do it, then great. But people with dementia who are already very confused and very distressed and very fearful of that kind of care, to suddenly have some faceless robot come and do it, I just think is some kind of dystopian nightmare that I don't think we're ever going to want to get to. Which then suggests that, okay, we've got a lot of these frontline entry level jobs which are going to need to be filled. Yeah, while your delivery driver job or your taxi job or your factory job is being replaced by automation, there is a care career here for you. But again, if we don't get into schools, then we don't get into young people expressing that benefit of it, then we're never going to get there.
Yeah, I think the automation of like the delivery of care, I think, is something that's really interesting, because it's obviously a big prize if it was to happen. But in all the spectrum of roles and jobs within health and social care, the doctors are going to go first, right? Their jobs are essentially, like LLMs. You take a data input across, history, examination, tests, you crunch the numbers and you come up with a diagnosis and a management plan. Compare that to, care, which really is about, as you say, social interactions, care, compassion, interpersonal dynamics. Like, very, very hard to replace that in a way that's going to be
So do you think, because my brother-in-law's just qualified as a doctor, he's doing his sort of GP rotation. And I was talking to him and I was talking to another family member who's a lawyer.
Yeah.
We're having this really big discussion at a wedding, actually. So we'd all had a bit too much to drink.
Yeah.
And part of it that was really resonated with me about replacing these roles with AI is the lack of accountability, that you still need someone who's going to be accountable. Even if you're using AI to do the busy work, you need someone to actually go, no, I'm going to make the decision, because you can't have a robot that's accountable. Maybe we'll get to a point where robots can be accountable. I don't know. Maybe that's down the line. What do you think about that? I'm interested in your perspective as a doctor, a former doctor. I don't know. You're still a doctor, aren't you? I imagine.
Yeah. In theory, yeah. In theory,
Yeah.
in practice. I think a very valid point, but like, why do you need accountability? Like, it's like with self-driving cars, people are very scared of self-driving cars because they think when it goes wrong and someone dies, it's the end of the world, which is obviously terrible. But if it's 10 or 100 times safer than a human driver, then is that not an acceptable level of risk? And I think maybe it's the same with doctors, right? Like, human doctors are hugely fallible. They get tired, they can be poorly trained, they can have their own biases, whatever. How much safer or more reliable does a piece of technology need to be before we assume that it can be accountable for what it does? I don't think this is an overnight thing, but I definitely see a world where the machines are better than the humans at some of the stuff we do, and we kind of accept that.
Yeah, where your e-consult is a chatbot. That's your sort of
yeah.
And we're not far off that. I use ChatGPT to diagnose myself before I go see a doctor, which is probably the doctors probably hate that. They go, oh yeah, he's been on ChatGPT, thinks he's got the answers.
But it's an extension of something that people have been doing for ages. But I think it's a lot better than Googling it.
Yeah, much better.
I think it's an interesting progression. And I guess from a doctor point of view, like I don't think they're going to be extinct in the next, couple of generations, but I think the job will be very, very different. And you see it definitely with things like, radiologists, who that used to be very much about reading scans and reporting on scans. And that's largely becoming automated now. And so their job's much more interventional, right? And what that's done is actually, rather than replace radiologists, it's changed their job and meant that now they spend more of their time doing, really impressive and high tech interventions and treatments that are really, really good for patients. So, that change has been broadly positive, I think. And it's exciting.
And I think it's exciting. I think there's a lot of pessimism about AI and the impact, but and I think it's similar pessimism during the last industrial revolution, wasn't it? And what are all our farmers going to do, and what are our factory workers going to do? And I think it's the same thing. I think if you go into it with a negative mindset, then perhaps that's where we'll end up. But I think there is a lot of cause for hope. And like I say about the care workforce, I think I think you'll struggle to replace that. I think there are maybe some roles, perhaps some of our sort of operational quality assurance roles, they might go because a lot of that could be done by automation. But again, half of the role of my quality manager is supporting the registered manager and being that sounding board and reassurance that actually everything's going to be, you've had a really shit day, but actually it's going to be okay, and we're here to help you. I think a ChatGPT can say that all it likes at the beginning of its spiel, but it's less believable than having someone sat in the office with you, isn't it?
Totally.
And I think at every level, it's like you were saying with the radiologists and the GPs and nurses, the whole lot. Maybe it makes people more caring because they've got more time to spend with people face to face, doing the caring thing, whatever that looks like.
Great. Ian Bennett, it's been a pleasure talking to you. Thank you very much for coming on the podcast. Where can people go if they want to find out more about reinventing social care?
I think just Google us. I can't remember what the website is, but yeah, Google us.
I'll link it in the comments.
And I would encourage you to talk to David as well, because he's really passionate and knows a lot. But yeah, it's great to talk to you. Thank you, Charles.
Thanks a lot.